Let's walk through a real-world case that highlights how a weakened immune system can lead to a peaceful passing. Key knowledge for anyone studying or working in medicine. So, I had a 76-year-old woman arrive to urgent care brought in by her spouse. The spouse explains that last night the patient seemed like herself. However, this morning there was notable weakness, confusion, and some episodes of urinary incontinence. Although the patient has baseline dementia, her spouse reports a noticeable decline in her overall condition, including increased confusion and worsening weakness. She had a complex medical history including immune deficiency, pancytopenia, adrenal insufficiency, low potassium, colitis, hypertension, high cholesterol, and a recent bout of sepsis. Her meds list: IVIG for her immune deficiency, valsartan, metoprolol, potassium chloride, Brio ellipta, hydrocortisone, spironolactone, budesonide, and Lipitor. This frail patient is clearly navigating a number of health-related obstacles. On exam she knew who she was and where, but not the year or president. Her spouse explains she'd normally know the year. She was extremely weak, couldn't even stand. It was also difficult for her to raise her arms. She was underweight, had diminished lung sounds at the bases, her heart sounds were distant, and her right pupil was bigger than her left. She was quickly transported to the emergency department via ambulance. Her labs are positive for a urinary tract infection. Procalcitonin was elevated, which confirms bacterial infection. Luckily, her lactate was not elevated, so she was negative for sepsis. There was a mild elevation of troponin, indicating a non-specific type of heart stress. Her pro-BNP gave us more information as it was sky high, pointing to heart failure. Also, her COVID-19 test was positive. Imaging? Head CT was surprisingly negative. No head MRI was performed. Her chest X-ray unfortunately showed pneumonia in both lungs. Her abdominal CT was negative for any abdominal complication. But interestingly enough, it picked up a lot of fluid around her heart, which is known as a pericardial effusion. This explains why her pro-BNP would have been elevated, and the pericardial effusion was likely caused by COVID-19. Her quality of life had been gradually declining over the past year. Dementia added another layer of difficulty, compounded by her immunosuppressed state. With a urinary tract infection, bilateral pneumonia, COVID-19, and a pericardial effusion, she faces a heightened risk for serious complications moving forward. After thoughtful conversations with her care team and spouse, there was a shared understanding that focusing on comfort care would best honor her needs and provide the most compassionate path forward. Subsequently, she passed peacefully within the next 24 hours. Here's what I want you to remember: her compromised immune system, age, adrenal insufficiency, steroid use, poor nutrition, and dementia put her at risk for serious health complications. Frail patients like this are highly vulnerable to infections. Recognizing how these factors interact is essential when caring for older adults. They not only impact her quality of life, but also significantly raise her risk for future health complications. Openly and gently sharing this with the family is a deeply meaningful part of the shared decision-making process, helping them understand, cope, and make choices that truly honor their loved one's dignity, comfort, and wishes in the times ahead.